From the dawn of time, those suffering from mental illnesses have been misunderstood and grossly mistreated. Methods used to treat mental illnesses were often much worse than the actual symptoms experienced from their mental illnesses. During the 17th century, women with undiagnosed hysteria or epilepsy were burned at the stake for what others said was for their own good. Others, during the 17th and 18th century, turned to stomping on the patient to cure him or her. They believed this would rid the person's body of evil spirits.
Then came hydrotherapy. Treatments consisted of water dowsing, which is basically the equivalent of being repeatedly waterboarded with ice-cold water. This then transitioned to a bath version where many were forced to sit in there for hours or even days with pressure resembling a fire hose. And if those two weren't horrible enough, next came the creation of the bath of surprise, where we would drop the patient from a trap door into the freezing water below. We believed this would shock the person out of their delusions and rage-filled lives. In 1818, O'Halloran developed his own version of the swing to treat mental illness, even though he had never heard of an instance where other versions had worked. The patient was strapped into this contraption where he or she would then be turned 40 to 100 times per minute. Although this device was used to treat delusions and uncooperative patients, to name a few, the centrifugal force caused horrific effects like severe anxiety, nausea, and a feeling of suffocation, which acted more as a torture device than treatment. As if the actual treatments weren't bad enough, the living situation left much to be desired. Instead of trying to help those with mental illness overcome their battle, the mentally sane wanted them hidden away as far as possible. They were imprisoned and chained to the walls in the tiny cell. The straw floor was the only source of heat. It quickly became evident that they were left there to rot and wither away instead of to get treatment. We essentially saw them as beasts instead of humans. Patients also had to worry about being locked inside varying sizes of restraint beds or cribs as a form of treatment, which often turned into punishment. Unfortunately, they could be left in these for hours, days, weeks, even months. They were at the mercy of the workers. These cribs could cause pressure ulcers and other physical problems because patients weren't able to move in the smaller cribs like the Utica. Fast forward to today, fortunately, mental health treatments have come a long way in the United States. Treatment modalities have since become more humane with a more holistic approach, and that's in big part to Philippe Pinel and Dorothea Dix. Now, there is a major emphasis on providing creative therapeutic outlets where patients can express their feelings without fear of retribution. They are no longer locked up and left to die or forced to suffer through many of the early treatment modalities. Many of them are free to roam the halls, talk to other patients, and participate in craft activities. In fact, hospitals now allow their patients to paint, draw, and make objects with their hands as a part of their treatment. There was also a huge change for mental health when it came to kids. Students at Woodson were able to transfer their anxiety and fears into building numerous cars, one in which won several awards. They learned to cook, how to cope, and even had parties with Santa. Nurses treated them like normal kids and not like lost causes. Adults were also treated in the same manner. Patients were able to learn how to sew, make fishing lures, how to check whether or not Christmas lights were good or bad, and this was all thanks to the creation of programs like Show Me Industries and other sheltered workshops. These groups prepared patients to become independent individuals once out in their communities. They also gave patients a sense of worth and self-accomplishment because patients were paid for their work for the first time ever. While we still implement versions of early treatments just more humanely, the focus is more on thoughts and feelings. Individual and group therapy has become central to an individual's treatment. Whether it be through immersion therapy or desensitization, we try to eliminate maladaptive thoughts from their mind. Unfortunately, while we have come a long way, there is still so much more to be done. Mental health has become much less stigmatized and many treatments are more humane, but we can always do better. We may be more evolved, but there are still many countries who still use chaining and imprisonment as a treatment of choice. As nurses, we have the privilege and the responsibility to educate others about what mental health really is.